Good morning, Dr. Drew Duquette here. I'm going to take a few minutes of your time to explain what makes our functional medicine clinic different than other functional medicine clinics. We know the difference when it comes to standard medications. Standard medications address the underlying symptoms of a problem, managing that but not resolving them. Functional medicine, by definition, treats the underlying reason why you have those symptoms. So in other words, it addresses the roots. But what makes us different than other functional medicine clinics? I have listed a few things here that we'll go over real briefly. First thing is we do not do protocol medicine. Protocol medicine is when you go to a practitioner, a doctor, let's say with a group of symptoms, one of which being migraine headaches, and they give you a prescription or they give you a natural product, magnesium or riboflavin or something like that, and say, call me in a few weeks and let me know how you're feeling if that helps your migraines. That's protocol medicine. You have a disease and then you treat it with something similar to medication, only it's safer. It's like supplements and things like that. That's not what we do. Because even if that did work for that migraine patient, it still didn't address the underlying reason. Why are they magnesium deficient? Why are they riboflavin deficient? You need to peel that onion back further and get to the root cause of why they're having that. That is a protocol medicine. That is pretty much what a lot of functional medicine doctors do, but here in our clinic we do not do. It's very customized to you in particular. The second one is holistic or comprehensive. We do not take a linear approach when it comes to your health. What we do is we dig very deep. If you're in bad health and you're having some serious chronic health issues, it isn't because of one thing. It isn't because of toxicities or just infections or stress. It's a combination of all of that. That is the total allostatic load that your body is expressing. We're finding this more and more as we see patients. They're getting worse and worse. They're getting sicker and sicker. And more things are coming in and bombarding them all at once. So you have to take a comprehensive holistic approach. You can't just treat it linearly and say, well, we're going to do this and let me know how this symptom feels, and then we're going to do this, let me know how this symptom feels. That's not how it works. You look at the whole picture, find out exactly why that patient is in that position that they're in, and you treat everything, whether it be the foods, what they eat, drink, they think. It could be their environment. We get into things like their home environment. What are they breathing? The electromagnetic radiation in there. It's not just the organic foods. We look at the toxicities that they may be going through. All of this creates a burden on the body that results in disease. And if you don't address it all, you're not going to get the results you want. And that's why we get the results that we do, because we and our whole team here, we address all of the issues that could be contributing to your poor health. That's the comprehensive. Preventative, that which cures also can prevent. And that's what prevents also is the cure. So what we find that we actually resolve your issues with by treating the underlying roots, that is what you need to know to prevent that from happening again. Does that make sense to you? So whatever is the prevention of a disease is also the cure, and vice versa. So that's something you need to know and why we're different. Personal support. This isn't a team of people. We give you a manual and say, here, read the manual and let us know how you're doing with it. You have one-on-one support with myself, Kendra, Jenny, the rest of the staff. We are all there working for one thing, your benefit. We have an open door policy where if you have any questions at all, you can call any one of us at any time. When you become a member of our clinic and undergo one of our programs for health restoration, you have free access to us as much as you want. It's all about personal support, because as you're going through this is not an easy thing to do. There's a lot of questions you're going to have, and you're going to need these questions addressed, and that's why we're here for you. Custom programs. Custom programs are just that. They are programs designed specifically for you. We do laboratory tests to find out exactly what the root causes of your problems are. Then we develop a program specifically to treat you, because everybody is a little bit different. This goes hand in hand with protocol medicine. We do not do linear protocol treatments. We do very customized programs. Now, some of the programs there are a lot of similarities between one person's program and another because we all live in the same world and we all have the same type of problems. So there are a lot of similarities. But these programs that we put together, if you become a patient of ours, are specifically designed and tailored to you and you alone. Tools for life, number 6. The biggest thing you're going to get in our programs is information. Information on how you got to where you're at, how to get out of there, and how to stay out of that. So Tools for Life is just that. What you're going to learn in these programs of ours is how to get healthy and how to stay healthy without managing the symptoms with medications or surgical procedures. That only lasts so long anyways. Most of our patients come in, they say, I've been on medications. A doctor will treat them with medications for a particular symptom or condition, and 10 years goes by, they had upped a medication because it wasn't working anymore. 15 years go by, that wasn't working at all, so then they had to change, get stronger medication, until eventually they get to the point where no medications at any dosage helps them. And the doctor literally throws up his hands and says, there's nothing else I can do for you. And that's true because you have not addressed the underlying causes of these problems. You're only kicking that medical can or that symptom can down the road. And that's no way to treat chronic disease. You have to look at the causes. And for most people, there are several involved in developing this. If you get a chance, take a look at my functional medicine tree video. This goes into the diagrammatic representation of what functional medicine is. A pretty easy way to understand a complex issue. Number 7, step-by-step instructions. It would be crazy. People that come in are very sick and they have a lot on their plate already. We don't want to dump information on them, even if it's accurate information all at once. We do it a little at a time, one step at a time. In these programs that we offer, we don't expect you to see or get to the top of the stairs on the first day. All we want you to see and all we're going to show you is how to take that first step. Then later we'll take the second step, and then the third, and then the fourth, until you finally get to the top of the stairs, which is where we want to be, is good health. If you try to make that leap in one, it'd be overwhelming. You couldn't do it. There's too much information to learn. So we present it in a step-by-step instruction, one step at a time. Just do this, and then you start to feel better and get more encouragement, and then you start going all the way up, and before too long, you're at the very top of the stairs, and your health has returned. These are the 7 reasons why we are different than functional medicine clinicians in the area. We don't do protocol medicine. We have comprehensive approach. Preventative is something that we're really keen on. Personal support, you can contact us anytime. Custom programs designed specifically for you and your symptoms. Tools for life, things that even when you leave here, you'll have the information you know to get healthy, stay healthy, and even help your friends and family get healthy and stay healthy. Step-by-step instruction to make it easy so that you're not overwhelmed with all this information you're going to be learning over the next several months of the program. I'm Dr. Drew Duquette. I want to thank you for watching, and I'll talk to you soon. Thank you.